Hello everyone, welcome to Nurse on the Move once again with another amazing video I have for y'all. So this pandemic, or should I say bandemic, has brought so many new travel nurses, and it's amazing because it's just like about time you all found out your worth. You're worth more, you need to get paid more, and you deserve more. So I'm excited that there are new travel nurses. So first things first, this video is really just to talk about the things, the etiquette, some travel nurse etiquette that should be adopted. And if you have already been a travel nurse, that's fine, because you can always learn more about travel nursing and how to conduct yourself. So first things first, let's talk about pay, and let's talk about talking about your pay, because that's a no, sis. Don't talk about your pay, or MERS, because I do have some MERSes up in here. That's a no, y'all. Let's not talk about our pay, especially to, around the staff nurses and the travel nurses for that matter, because you might find out that someone that's working with your same company is getting paid more or less than you. And not only that, but as a staff nurse, hearing about travel nurse pay, and when we're all doing the same job, that kind of makes them feel, uncomfortable, sad. So that is number one. Let's not talk about pay in the workplace, and let's just kind of keep that to ourselves, how much we're getting paid, because you might get your feelings hurt hearing how much somebody else makes, and it might be more than how much you make. So that's number one. Another thing that is important to know is when it comes to patient assignments and just going with the flow, y'all. We have to go with the flow. We're here to help out. We're here to help these hospitals that are short-staffed. And when we get a patient assignment that we probably don't necessarily like, let's just go with the flow, because they're not only we're getting paid more, but we get holidays off if we put that in our contract. So we're kind of here to be supplemental. So when we're very opinionated and saying, I don't want this assignment, I don't want that assignment, it's not a good look on you, and you, especially if you want to renew your contract. They're going to remember that you were the person that refused their assignment, or you were the person that had all this stuff to say about you having this one COVID patient. Now that COVID is kind of like dwindling down, a lot of times you probably would want to renew. So it's best to keep up your, your travel nurse etiquette and just take what comes. And if you don't want that assignment, then deal with the assignment just for the day, and then at the end of the day, tell the charge nurse, like, hey, I don't want this patient back, or, XYZ. But just really going with the flow is very important when it comes to travel nursing. So another thing is being prepared. Come in there prepared, ready to go immediately. A lot of times, well, sometimes I'll say, there are a lack of resources on the unit. So when I say come prepared, I mean with your stethoscope, your pen, your Sharpie, your dry erase marker, everything that you will need for your shift. Me, right now, I work on a neurosurgical unit, or neurosurgery unit. So, remember to have my pen light, and, knowing the NIH stroke scale, remembering these things. In the room, there are a lot of like cheat sheets to remember the NIH stroke scale, but just being on top of it and knowing what you're doing, and being knowledgeable, and knowing your craft. That's important, because as a travel nurse, we're expected to know what we're doing. We're expected to know our stuff. So when you come in, knowing what you're doing, in and out, like boom, bling, blow, burr. Some other etiquette that is important to know is just to kind of feel the floor, feel your coworkers, because you may be working on a floor that the type of vibe is like, you know, everybody for yourself. The call bell might be ringing, and, you know, let's say IV's going off and the call bell, you know, somebody says my IV's going off. You may work in a unit where the person who picked up the phone is like, okay, I'll fix the IV. Or you might work in a unit where they're calling you like, hey, your IV's going off in room whatever. So, you know, noticing what kind of vibe you're doing, what kind of vibe your floor is on, so you can know how to act accordingly. Because if, you know, you're on a floor that everybody's super helpful and everybody helps each other, you need to get in there and be helpful just like them, you know, because you don't want to be the person that sticks out like a sore thumb because you don't want to fix air and line in somebody's room, even though somebody's been helping you all day. So that is major, and that's something I had to learn, because I'm the type of nurse that I got it. Like, I don't really need help. I don't ask for help. I don't want help. So when I'm in these different floors where everyone is super hands-on and it's like a team, then I have to get in there and I have to be with the teamwork too, you know, and I have to help too. So that is a really, really, you know, important thing that I've noticed as being, you know, a travel nurse. Another thing that is important is for when you have your preceptor days, when you are precepting, make sure you are very focused and intentional about those 1, 2, or 3 days that you might have. Be very intentional about the questions that you ask. Be intentional about the questions you ask, pretty much, because hospitals and policies differ. So let's say that, you know, there's one hospital, you know, you might have IV change for secondary tubing every 24 hours, and then somewhere else has 72 hours. So knowing these little specific details are really good, because a lot of preceptors, they won't tell you unless you ask. So even when it comes to charting and things like that, make sure you ask the right questions. Make sure you ask the good questions, so that when you are off of orientation, you don't have to backtrack and ask things that you probably could have already found out or could have already known. So as a new traveler, make sure that you try your hardest not to call out. So calling out is one of those things that is shunned upon, whether you're a staff nurse or you're a travel nurse. Not only will you not get paid for that day, but if the people don't have a heads up and you call off, you know, let's say 2 or 3 hours before your shift, it is definitely negatively looked at. So I would suggest, if you have to call out and you know a couple days before, make sure you let the manager know, or try to switch around shifts with one of your coworkers. Because when it comes to retention and when it comes to renewing your contract or coming back, let's say that you leave and you want to come back to that hospital, they're going to look at, oh, they called out 2 hours before multiple times. And don't get me wrong, things do happen and you have to call out sometimes 2 hours before, but try your hardest. If you don't have to, then don't. Try to switch around shifts, but if you do, be very open and honest with your manager, because they are the ones that are going to be signing off on how good your performance was. And not only do you want to look good for the hospital, but you also want to look good for your company as a whole, because your company, your recruiters are going to be the ones that are going to push for you when it comes to another contract, or kind of be like, nah, not pushing for you. Because yeah. So canceling your contract. I don't know much about canceling your contract because I haven't done it before. I guess I have done it before once, but it was before I actually started. I never started. So cancel your contract is a no-no, but when it comes to patient safety concerns, when it comes to your nursing license or anything like that that will jeopardize you or your license, get out of there, period. No, do not jeopardize your future, your license for anybody or anything, because we worked hard for RN. We worked hard for those 2 letters behind our name. So if you have to cancel your contract, then cancel your contract, boo. Another important thing that I want to say to the new travel nurses, and even if you are a travel nurse and you feel this way, is that it's okay and it is recommended that you have multiple agencies that you work with. One agency may not have the pay that you want. Another agency may not have the location that you want. And another agency, you just might not like the recruiter. Who knows? You just may not like what they stand for or something like that. So being able to shop with different agencies is important and it's good, very, very good. But it is a pain to, you know, do all these checklists and to get all these references, but it is worth it when it comes down to getting to the bag. Not only getting to the bag, but getting to where you want to go, you know, the safe bag. So deal with different agencies. It is good. I know, you know, if you're new to traveling, you know, one agency, if you're satisfied with one agency, that might be good, but you might be satisfied because you don't know what else is out there. So go ahead and shop around, do different agencies. So all in all, I just want to say that being open and honest is the best way to go. Go with the flow. Go with the flow of your workflow. You know, we're here to have a good 3-day-a-week shifts, okay? Good shifts, 3 days a week. Let's just go with the flow, okay? No matter what your assignment is, just knock it out. Do the best you can do with your patients that you have, and you know, show them why you're a travel nurse, because you're able to adapt to different situations. That's why we're travel nurses, because we can adapt. Whatever you give to us, we'll take it, and we're gonna roll with the punches, and we're gonna look good while doing it, okay? So all in all, happy traveling, everyone, and stay safe. And please make sure that you subscribe and watch more videos, because I got some more stuff coming for you all. So bye.